Welcome to the Association of Healthcare Emergency Preparedness Professionals podcast. AHEPP was formed in 2014 to move preparedness forward by advancing the profession through best practice sharing, education, and professional standards. We hope that you enjoy this program.
Hi, this is Kristi with the Association of Healthcare Emergency Preparedness Professionals here today. It is May 19th. We are here talking today with Tom Bedard. Tom is the chair of the American Meteorological Society's Committee on Emergency Management and the implementation manager at AccuWeather Enterprise Solutions. He receives his bachelor's degree in meteorology from Penn State and has worked as a FEMA course developer for the National Disaster Preparedness Training Center and as a solutions analyst for risk management solutions. He lives in Wichita, Kansas, where he volunteers as an EMT, firefighter, and grant specialist for Coal Ridge Fire Department. So, Tom, great to have you here to talk to us today. Clearly, we are in the spring talking to a meteorologist, so obviously we're talking about tornadoes and tornado response and severe weather. So you live in Wichita, huh? Isn't that the center of Tornado Alley?
You know, when I moved here about 3 years ago from the New York City area, I thought it was going to be the center of Tornado Alley. And having been raised on Twister, I couldn't have been more excited to get down into the plains, spend every weekend chasing. And since moving here, we really haven't had that much in terms of tornadic activity in Wichita. Tornado Alley is seeming to move a little farther east and a little farther south. So if we were in the southeastern U.S., it would be a much different story. But the view of Kansas as a hot spot for tornadoes kind of seems like it's going by the wayside as of late.
Wow, so that was just created as a myth from Twister, I suppose. All I picture in my head is all of those wind chimes twisting around from that movie. Oh, and the cows flying. So clearly Kansas is maybe not quite like I envision it.
Well, I mean, keep all of your dreams of Kansas there. We have grain elevators. I've got one hanging out in the back room of my office. And wind chimes, ever since that movie, still give me nightmares. So whenever I hear them, I pull up my phone and check to see if the SPC has issued a tornado watch. But we do get severe weather in Kansas. Unfortunately, severe weather just knows when you're a meteorologist and tends to avoid you. So everybody who lives in a town packed full of meteorologists, whether it's Norman, Oklahoma, Wichita, Kansas, State College, Pennsylvania, the storms always seem to break around the town and then reform out to the east. It's our mild form of a conspiracy theory within the weather community.
Okay, well, you feel free to move to Nebraska so that we can keep them away from here too. So we're going to talk. We have a few questions for you, and we want to kind of touch base on, what it is to do your job and what your recommendations are for healthcare. Obviously, we serve the healthcare community as an association, and we want to make sure that we have great information on best practices in healthcare and responding to severe weather events. So one of the questions I wanted to talk about is, what are your recommendations specifically to healthcare facilities, and not just hospitals, but keep in mind we serve lots of healthcare facilities, and there's so many different kinds. So hospitals are one thing, and we heard about Joplin and what happened with the tornado hitting Joplin's hospital. But we also, hear about long-term cares as well, and long-term cares can be possibly even more vulnerable because they're kind of everywhere and in small communities, and they're not avoiding those big cities like the tornadoes tend to do. And so, what is your thoughts? What do you think that really want to get out there to the healthcare community on what we should really be doing to get ready for this?
There are so many different types of risks and vulnerabilities that the spectrum of healthcare facilities have to endure. The number one recommendation is to follow the all hazards approach to emergency management. Because you've got so many different types of operations within a dialysis center a long-term healthcare facility, a rehab facility, a hospital. You have all of these different movements that have to go into place to make sure that your patients stay safe. So if you follow the all hazards approach to emergency management, instead of just developing that one tornado plan, develop that plan for sheltering your patients, for evacuating your patients, and know when you want to perhaps not have people in the building that day if you want to cancel elective surgeries or something like that. I offer that because tornadoes are one threat that these facilities face. A tornado coming towards your facility presents the threat of windborne debris. It can cause structural damage, and there's a lot of other pieces that make it dangerous to be on those exterior facing walls. So as a meteorologist, what I would recommend is know what you need to do to keep your patients and your staff members safe. If you've got a risk to windows breaking, if you've got a risk of debris hitting and damaging your facility, because whether it's a tornado, whether it's a microburst, or whether it's some sort of hazard, you should be ready to respond regardless of what that hazard is.
So Tom, what are your best recommendations for healthcare facilities to really be prepared for that severe weather event? You know, we all talk about it, we all drill, and the tornado drills, they get to be commonplace. Everybody does them all the time. So what are your thoughts on what we should really be preparing for in healthcare?
So I've got 3 recommendations, and they're going to be kind of general because there's a lot of different types of facilities and vulnerabilities that are included inside of the healthcare spectrum, from a dialysis center to long-term health, to a rehab facility and hospital. You have so many different operations that you have to plan for. So the 3 recommendations that I would give would be to know your vulnerabilities and your risks. That includes how long it's going to take you to get your patients from where they're at to where they can shelter. The second is to follow the FEMA all hazards approach to emergency management. So don't create like a litany of hurricane and downburst and flash flooding plans, but instead know what operation you need to do to keep your patients safe from a particular hazard and know how long it takes you to do that. The third is to have 3 ways to get those warnings. Disasters are what they are. They are disasters. And so you are going to perhaps lose one of those modes of getting warnings in. So make sure you've at least got double, if not triple redundancy in getting your warning.
Well, speaking of warnings, I have a million apps on my phone, and I have yet to find the app that says, warning, warning, Kristi, the tornado is in your backyard, because that's really when I'm ready to go downstairs. What do you think do you have a favorite app? Do you have a best warning system? And clearly, you know, tornado in your backyard is not realistic, and especially in a healthcare setting, you obviously want more time than that. But what are the most accurate warning systems that you know of out there?
Well, if you want the most accurate one, our field came up with a number of years ago, an incredibly sophisticated one called the Weather Rock. It's a weather hanging off a string. If it's gone, that means there's a tornado. So in terms of the most accurate one in the backyard, probably the Weather Rock. Outside of that, there's 3 different types of services that exist out there. I'm probably going to beat this rule of 3s thing into the ground throughout this entire podcast, but for anybody in the public sector, including hospitals, healthcare associations, anybody, the National Weather Service exists to give you warnings when they see a storm present. They're going to highlight a polygon where they see that threat potentially going. And if you're inside of that polygon, that means you should be responding. What we always want to avoid is folks looking at their phone once they get a tornado warning and then trying to assess it themselves if they don't have extensive training in radar meteorology. The second type of service is you can get a private sector service to let you know when your specific asset is going to be impacted by a tornado. And so there's the public sector with the weather service. There's a huge private sector out there that serves a lot of hospitals across the nation, and that will give you much more location-specific information. The third that some hospitals use that I have heard of, at least anecdotally, are detection systems. They use lightning frequency to let you know when a tornado could be possible. There is very little of no science that supports those, and it always makes me really itchy whenever I see somebody using like a handheld tornado detector or something they plug into a wall. Until we get to that point, and I can't wait until we do, use a meteorologist either through the Weather Service or through the private sector.
Wow, tornado detectors. That is something I have not heard of, but you know, we will fall for about anything when it comes to little devices and things that possibly work, right?
You know, when it's $20 and it tells you that it can give you an hour's of lead time or give you an hour's worth of lead time for your hospital, it's an interesting thing to experiment with, but the science just doesn't support it yet, but I'm really excited for the day that it does.
Awesome. Well, living here in Nebraska, I grew up in South Dakota. Not a lot of tornado activity up there. Moved to Nebraska, and people seem to be a lot more comfortable with tornadoes and how to handle them here. One thing that I was amazed of when I moved here was that the tornado warning came in, or you hear the sirens, and I have yet to meet a Nebraskan that hears a tornado siren and goes to the basement. It's always outside. Always outside. Go look, check it out, figure it out. Do I see anything? Obviously, I'm sure that that's not something that you would recommend, but I have been to like storm spotting classes. I mean, is that something that's helpful tool in an emergency response coordinator's belt to like just have that knowledge? I mean, of the storm spotting class. I mean, because I do think I learned a lot from going to that. Now, don't get me wrong, I'm not going to get in my pickup and start chasing tornadoes, but I do think that there was some valuable information during those classes. What do you think about that?
Absolutely. So whoever runs training for any particular healthcare facility should absolutely consider having your staff go to a National Weather Service Skywarn training course, or bringing your National Weather Service warning coordination meteorologist in to train your staff. It doesn't cost anything. It's only a couple of hours. And it's really helpful in identifying the cloud features to let you know that something bad's going to happen, radar features to let you know something bad's going to happen, and more importantly, to know what different types of warnings mean. Where you are in Nebraska, do you know what triggers your outdoor warning sirens?
No. Should I be aware of that?
You can learn that. So usually your local emergency management agency will have it on their website somewhere, but for the most part, NWS tornado warnings will have it. In the Midwest, a lot of rural counties will have this stipulation in their emergency operations plan that they can activate it if they see a funnel cloud without a warning being issued.
I have heard that. Yeah, I think that might be what it is. Like there, because I've heard that, you know, if you're a spotter and you're connected somehow with the weather service, they'll take your word for it and activate sirens if you see one.
There's a secret password. Right? We have a handshake. There's a code word actually with it too. The spotters are a really invaluable part of the whole warning schema that we have as meteorologists, whether they're private or the public sector. Both of us look at those reports that come out. We look at webcams across the U.S. So the storm spotters are an absolutely critical role. And that was one of the things during this COVID-19 pandemic that we were kind of worried about, because if you have spotters who are doing their due diligence, not leaving their town, staying where they are, you might have a decrease in the amount of storm reports that you get out and about. Some of those reports are used to file insurance claims, like reporting the size of hail, but even so much as getting an idea that there's a wall cloud from that storm that's just a blip on radar, but really, really far from one, is something that we really like to use to help us warn tornadoes. So we haven't seen that yet. It hasn't been an impact that has hit us, but it was something that we were really worried about because spotters are a really invaluable part of the warning system.
Well, technically, those spotters can be out and about still alone in their car and not spreading COVID at all. So might be a welcome distraction from the stay-at-home order.
Oh, absolutely. It's just getting to QT and then everybody congregating around the roller items because that is the best thing to eat on a chase. Would be that one moment where everyone gets risk of transmitting COVID to each other. I say somewhat tongue-in-cheek.
Well, okay, so moving along, I have a few additional questions, and one of them is, I know you've been around working with FEMA and, you know, the Meteorological Society for a long time. So as I mentioned before, we have tornado drills and we do these in healthcare often. And I think, there can be, even in schools and everywhere where they're required, there can be a little bit of, I don't know, drill fatigue, like, oh, here we go again, we're going to do this again. And I do remember one of the things, Joplin tornado response, one of the innovative things that was learned during that response in a hospital was all these patients that we bring to the middle of the hallways. And during a tornado watch, we're getting ready for this tornado, and usually it doesn't happen. So we bring our patients out to the hallway and we, follow the rules and go through the drill. And then once it's all clear, and we go back into the rooms. Well, when the tornado actually hit, they realized that many of these patients were ambulatory and could have helped by walking out of the facility, walking down the stairs, because the elevators were not functional. And yet didn't have their shoes because, they were patients in beds and they wheeled them out. So one of the most basic lessons learned was put the shoes on the bed when you bring these patients into the hallway. So that was just kind of mind-boggling to me that we learned such a valuable, important thing during that response. And it was so basic. And I was just curious, my question for you is, have you heard of any other innovative lessons learned like that are just things that are small tips that could make our response just a little bit better?
There is a hospital system in Northeast Kansas that performs mobility triage during a tornado watch. And when that watch is issued, it's sent across to all staff members through their mass notification system. And they'll have their primary care, and I'm not going to use the right term because I'm not in that healthcare setting, but they're going to use their staff members to go throughout all of the rooms and then mark on the door whether that patient needs to be brought out into bed, whether they can put their shoes on and shelter themselves, whether they need some special care during the time that they're sheltering. And so they do all of this legwork during the watch issuance. And that's helpful because on days where you've got a tornado watch present, you've got a good chance of getting a tornado. Now, there's going to be circumstances where you can get a tornado warning without a watch, but by taking that extra step and on that severe weather day, when that watch is issued, they do all of that work ahead of time. It makes their response much faster, much more efficient, and it also makes for better customer service to your patients. You're not panicking and throwing shoes at them and telling, get it all, we're all gonna die, run out. You are calmly having everybody go out to the hallway, and if somebody can put their own shoes on and walk out, they can. So that's something that in my private sector role, I've been trying to get all of our hospital clients to get on board with too.
I can see that being valuable in a hurricane setting as well. I mean, just about anything, right? That's valuable information.
Well, and it gets really complicated with hurricanes because you are given so much lead time that you don't know quite when to pull the trigger. And some hospitals along the Gulf Coast and the Eastern Seaboard have nailed this down to a science, but some could improve. And it's really difficult to know when you need to initiate your response for a hurricane. With a tornado, it's simple. When it's a watch, you get ready. When it's a warning, you respond. But with a hurricane, you've got to mix in when the county's going to be doing an evacuation, if they do an evacuation, when the winds are going to start, when the rain will start. There's so many different hazards and components to a hurricane that make a tornado actually kind of look easy by comparison.
Wow. I'm glad that I don't have to worry about hurricanes where I live, at least, only when I travel. So any other tips that you can think of that you've found throughout your experience?
It's really nice when a healthcare facility involves all of the staff in the notification process, so that when a tornado warning goes down or goes through to the facility, or a flood warning, anything, it goes to every staff member so that they can answer questions when patients or visitors or family members come and ask them. As we've all probably experienced at one point in time, being out in some business when a warning is issued and you're trying to talk to the staff member and they don't know what's going on and it's confusing and it's hectic, making the entire response calmer occurs by giving everybody that information. Whether or not a tornado warning is issued is not some sort of secret message. So getting that down to every staff member, and if you can, taking your emergency operations procedure and putting that into the notification. Almost every hospital that I've spoken with has some sort of mass notification system. And so talk to your provider, take your EOP and put that into the warning so that when somebody gets a tornado warning at 3 o'clock or 3 a.m., it's their first day. They know what to do because it's in the text.
Awesome. That's a great idea.
And I'll add one more snippet in there. Talk with your ambulance company. So if they're trying to bring somebody into your facility and you are sheltering because of a tornado warning, make sure they know about it. It's not something that I've ever run into running 911 as a BLS provider, but it's always something that's concerned me, that we would get to a facility and something would happen that we wouldn't know about, we wouldn't be able to get in. So inside of the healthcare coalition that you have, try to collaboratively plan so you guys all have the same approach to severe weather and that your emergency responders are on the same page as your healthcare providers.
Wow, that's a great information and not something that I've run into with other exercises that we've discussed before. So that's great. So you alluded to COVID and the response there. Has life changed in your world because of the pandemic, or is it just kind of business as usual, but keep people 6 feet apart when you're talking about sheltering?
The stakes are much higher for every disaster now. The federal and state resources are taxed by this. Local resources are taxed by this. It's important that everybody has a perfect response if you can. Inside of the weather sector, we've been impacted by folks being concerned that they can't go to a shelter because it's been closed due to the pandemic. For tornado sheltering, it was a somewhat simpler answer. Check with your county emergency management agency and see if the shelter's open. My AMS committee published a statement that the AMS ended up taking and publishing as a full statement in force that encouraged people to know where they can shelter, make sure that shelter's open, and then to follow CDC guidelines inside of that shelter where possible. With hurricane season, where most of my time is spent now, it's going to get much more complicated. It's been far from business as usual, and my entire team and my entire committee have both felt like we really need to be out there with good best practices and good guidelines, echoing everything that we can so that responses are flawless. We really don't have much wiggle room anymore with a pandemic occurring at the same time as an active hurricane season and what's already been an active tornado season.
So I guess, something that we are to the point where we're just going to have to continue to deal with life with COVID pandemic the way that we have been all along. And I think that, as we keep saying with everything with this pandemic, life might just be different from here on out, and we're going to start getting used to it at some point, right? Okay, well, I think that we had a couple of events that you maybe wanted to make us aware of.
Yeah, absolutely. So we have two important ones coming up. We passed Severe Weather Awareness Week. That happened earlier this year, obviously, because we're in the midst of severe weather. And as we're recording this, my fingers are crossed, but also not crossed that Wichita gets to see some good thunderstorms this weekend. We have National Hurricane Awareness Week, and that was the first week of May. I do want to say that it's looking like it's going to be a very active season. Obviously, we already had Tropical Storm Arthur off the East Coast. My committee is working on some statements for hurricane sheltering, and everybody is trying to figure out exactly how we're going to make this happen. The next one that is going to seem a little odd is Heat Awareness Day is May 29th. Having worked with K through 12 institutions, healthcare, universities, and the private sector, the heat hazards and heat threats from high heat stress is still something that we don't handle well at all. It aggravates existing conditions. It's something that you can mitigate through good policies and procedures, but we have an opportunity to train and perform continuing education with healthcare staff so that you are able to recognize outside of the healthcare setting when somebody's going through a heat-related illness, and where possible to provide community medicine to get ahead of somebody experiencing a heat-related illness. The risk posed by being inside of a cooling center is something that may change during the COVID-19 pandemic that I haven't looked into as much as I'd like to. But I did want to point out that May 29th is an excellent time to talk with local community members, with your 911 responders, and with your staff about heat awareness, because it is still a huge killer out there every year.
And I do hear about heat being a big concern, especially for people that work in home health agencies, because they have to care for people that may or may not have all of the cooling resources that are, usually available in a traditional healthcare setting. So, that's a really important thing to keep in mind. I also have relatives that live down in Arizona, so I know that heat can be extremely intense and problematic.
And it gets bad everywhere. It's all about what you're acclimatized to, which is a word that I'm probably going to butcher the pronunciation of. But as you guys are looking at forecasts to try to figure out whether or not a heat wave is going to happen, there's a couple of different values I might suggest other than the heat index, which is measured in the shade, and the afternoon high. Look at that overnight low temperature. It was in the UK's heat wave, I believe it was in 03, though I'm probably missing something there, that the worst impact or one of the worst hazards of that heat wave was the high overnight low temperature. So the body wasn't able to cool off at night, especially in a city environment where you hold on to heat during the day and release it during the night. The overnight high is a huge component rather into the impact of heat wave on the population. And also, if you're going to be outside, take a look at the wet bulb globe temperature. That takes into account the sunlight, the humidity, the wind speed. It's what OSHA and the DoD use to quantify heat stress. So where you can in your existing policies, get the heck away from the heat index and step away from the temperature. Look at the wet bulb globe or find an indice that works for you that includes the humidity, wind speed, and sunlight. And don't forget about the overnight low. That is a killer. Okay,
so help me out, Tom. A heat bulb globe. What? Say it again. And how do I find that information?
Different words. Wheat globe temperature. So it's the. Now I have to think about it. The wet bulb globe. The globe component. There's a little black plastic sphere on top of the probe, and that takes in all of the solar radiation, and it adds that value to the temperature. And the wet bulb is and this is going to pull back from early days being a weather observer in college, is the coolest that you can get air by evaporating water into it. So the wet bulb temperature is a good approximation for how cool you could get by sweating, and I'm probably messing that up a little bit, but the wet bulb globe temperature is the best approximation for heat stress. That is something that should be absolutely in every heat stress plan, and especially if you're a 911 system trying to get ahead of a heat wave, look at that wet bulb globe forecast over the heat index over the afternoon high.
So how do I get that information? Is that something that's reported somewhere?
Yeah, so the Weather Service, I believe, has started recording and reporting it. Your local weather forecast office can give you more information. There's equations available online. There's two of them. I think one through OSHA, one through the National Oceanic and Atmospheric Agency. But you can use an online calculator, or you can also call your local Weather Service office and see how you can get it from them.
Awesome. Well, I think I have gotten through all of the questions that I could possibly ask you today, and I appreciate your time, Tom. It's been extremely informative. We've enjoyed it and enjoyed talking to you. Is there anything else that you had for us that I didn't touch on today?
The only thing that I want to encourage every listener on this podcast to do is to look at the Weather Ready Nation program through the National Weather Service and consider becoming an ambassador. It's a way to get involved in community so you can ask questions of people much smarter than myself to get information on your emergency operations plan and preparedness. It's free, and it's a good show that you are part of the weather community and you want to be prepared. So other than that, I really appreciate the opportunity to talk with you today. It was a great time. Thank you.
Thank you. It's been fun. All right, folks, we're done with the podcast.
Thank you for listening to AHEP's podcast. We hope that you will come back and listen to other educational programs in the future. For more information, please visit our website at www.ahepp.org.